Okay, good morning all. Welcome to yet another exciting session. Today we have Dr. Surya Das. He's from our very own batch. I think all of you know him, and he was I'm a fellow proud Govtian who shared not only the dormitories, also very nice and interesting times with him. So he's been just before getting into the session. Dr. Surya Das, he's an extremely accomplished and experienced dental health professional. And needless to say, he's going to address a very important topic on dental health and will share some helpful tips, not only on the dental science perspective, but from professionalism and career building as well, right? So, he has a very illustrious profile. So just to briefly go through that, Dr. Suryakant is currently he has held a master in dental sciences, and is currently professor and head of postgraduate department in Orthodontics, SCB Medical College, and is presently working there. And but then he has completed his BDS in 1919 from the same college. He had topped the merit list in All India Postgraduate Entrance Examination, and did his MDS course in Orthodontics and Dentofacial Orthopedics at King George Medical College at Lucknow. And topping the All India merit list in 2000 was a unique feat that no one else till today has achieved from Odisha. He's also a gold medalist in both the BDS and MDS curriculum. And since 2004, he is working as a faculty in SCB Dental College in Cuttack, and as a chief consultant in the Sabitri Dentistry, a center of global excellence in dentistry. He has also served as president of lingual orthodontic. I apologize for the terminology. Still, we have to get acquainted with. So it's Lingual Orthodontic Society in India, and till 2002. Maybe I should have done my homework a little better. So till 2020, and his wife, Dr. Rajashree Das, an oral and maxillofacial surgeon, is working as a reader and associate professor at High-Tech Dental College and Bhubaneswar, and his son Sujan is in class 10th in DPS Kalinga. So that kind of a very brief of his expansive and illustrious career as a dentist. So without further ado, I will hand over the session to Dr. Surya Das to start. But before that, I just have a bit disclaimer. So we will have a bit of a departure from the, purely in terms of conducting the session. So we'll have a break in between. So all of us will have to sort of drop from this session, and we'll have a quick 3 to 5 minutes break, and we'll have to join back on the same session again on the same link. So just please make a note. If the session drops in between, we'll have to rejoin back, okay? So thank you again for joining. I will pass on the baton to Dr. Surya Das, please.
Thank you, Smarjit S. Das. It's like nothing like speaking in front of friends or the family, or the second family, what you call it. My sincere thanks to Ravi. I think my screen sharing is disabled. If you can enable my screen sharing, my screen sharing is...
Yeah, just a minute.
Yeah, PK, you have to make him host.
Yeah.
Let's make it an interactive session. It will not be a continuous thing. I'll be asking you questions just to,
Yeah, you can share now.
Now I can share. Oh, yes. Well, it's a concise presentation, just to, which usually we prepare or present to the crowd for educating purpose. But I will like that all our friends or any of our guests or family members, if you want to interrupt me in between to know a thing, it'll be a good discussion to start with. Well, can you tell me what a Can you tell me what is the importance of a tooth? Any of you, just if you can continue. Any of you can answer? Ravi, how many points you know importance about? If you know the importance of a tooth, probably the session ahead will be interesting for you. What all things do you know? Number one is chewing. All right.
It improves the beauty of your face.
Next.
Biting.
Biting. Okay. The same. Next.
It improves the beauty of your face.
It improves the beauty of the face. Next.
Smell, good smell or bad smell?
More to smile.
Okay, good smell, bad smell is something that, that's one of the diseases associated with the tooth. None of the taste buds are in the teeth.
Give shape to the chin, jaw.
That's beauty, jaw. Other important thing is phonetics. Smile. Other important thing
Speaking.
is phonetics.
Yeah. Yes.
I think our digestion start with the teeth after mastication.
Perfect.
Good chewing only, the digestion
If
will
you want
start.
a good skin, you need to have good set of teeth. If you want to speak well, want to be a good speaker also, you need to have complete set of teeth. If you want to look good, smile or greet, of course, in post-COVID time, when you do not have mask, that time, teeth play a very, very important role. It can make or break your relationship. That's true. And how we are going to take care of it so that we enjoy it. See, many things are there. Health is something that we all realize now. This is the real wealth. You know, that was the what message from this COVID era. How can we maintain it? And the logic behind the things, if I explain, probably you can pass on to your family and family or friends. You know, that becomes, that really spreads a lot to the crowd. Okay. If I go for different diseases, just, you know, here are a few. Caries, all of us know it. Poco Kaiwa. What is a caries? Remember, caries is, you know, there is no insect inside to. So, we have to understand what is it. Cavity is not caused by a bacteria. Yeah, it's caused, the decay is caused by the byproduct of a bacteria. Means there is a specific microorganism which is like Streptococcus mutans, but a specific. You have lots of microflora in your mouth. Same thing with your gut. You know, all of them are not harmful. So many are, you know, are helpful to you. There is a specific strain, Streptococcus mutans. This kind of bacteria, if they predominantly are living in your mouth, and how can they live in your mouth? Obviously, Ganga side, river Ganga side, if humans settled, so many people settled, it's because irrigation was better, it's because farming was better. We settled there. You know, all the civilizations, earlier civilizations are on the bank of rivers, right? So for this microorganism to live in your mouth, this microflora to live in your mouth, there should be adequate atmosphere inside. That should be adequate food for him to eat. And that the atmosphere should be good. Now here comes what? These bacteria, they feed on the sugary diet, or in short, sugary food. See, if you have a look, most of the cavities or the decays, they start from the top of the back teeth or from the front, not from inside, very rarely from inside. That's because your tongue is always playing with the lingual side or the inner side of the teeth. Means cleaning it, self-cleaning it. On the outer side, you have places where they can get stuck, right? So if you are giving an atmosphere which is good for this bacteria to live and spread their family. No, one bacteria is there, then he likes it, likes that place. Another 4, he multiplies, have children, kids, grandchildren, they keep on. Slowly, their population increases a lot inside your mouth, and slowly, other teeth get affected. How do they do it? They eat on this sugary diet. In the process, acid is secreted. They never eat the tooth surface. They feed on to this sugary diet, and in the process, byproducts like lactic acid, acidic byproducts are produced, which decay the enamel or the dentin. Truth is, the enamel layer is inorganic, by the way. Calcium phosphate is the major composition is calcium phosphate, and that's the way the decay starts. Once a small decay starts, it's impossible for us to keep that area clean, because it's like the moment there is a hole or a small hole. I'm not talking about this one. A place like this. Hope you can see my cursor. The place like this, if there is a small hole like this, you can imagine, your brush is not going to reach that place. Brush will never reach that place because it's a small dent on the tooth. All right. And food particles, whichever things get stuck there, we are unable to clean it. Obviously, we will be unable to clean it because the brush doesn't reach that place. Rather than these surfaces, which are more smooth. Look at my cursor. Here your brush can clean, but not these small areas. From here, the process starts. A small decay, again further deposits. The decay gets bigger and bigger, and ultimately you reach a place something like this. Then it's a pathology, you have to go for the treatment. So what is a filling? All of us know what is a filling, why it is required. So many people say it doesn't pain me. Why should I go for a filling? Well, the reason is when it is small like this, if I can feel this surface and make it smooth, if I can feel the surface and make it smooth, like the one on the lingual side, on this inner side or this surface, the smooth surfaces, then your brush can clean that area. Further deposits, that vicious cycle of deposits, then carious teeth, then the microbes again living onto it, again that is increasing. That vicious cycle is broken back. Other thing I told you, if you have so many caries in your teeth, you can be caries prone. How? I told you, if you allow a certain kind of microbe, all microbes do not cause cavities. If you allow certain kind of microbes to live in nicely in your mouth, they are obviously going to make the mouth more caries prone. Whenever you try, you have your kids having cavities, go for a restoration from the beginning. Once you go for the restoration, in a 6 months time, and do not say that this is a small cavity, I should not fill it up. If you fill up all the cavities and start fresh, knowing that you need to keep it clean, and the atmosphere or the atmosphere or the environment for the microbes to live in is taken away, they are going to die on their own. Other microbes will grow up, take their space. So it's like an ecosystem. Once one colony of microbes, they die out, or they just do not have atmosphere to grow in, the other microbes take up that space. So how can you do it? Number one is restoration. That's we call it as rehabilitation. We call it. Once you do that, then you know that it's not a microbe which is acting. You know that it's like if sugary diet or this kind of food. I'll come to the food part. Very interesting parts. I'll come for it. If these things are taken care of I can be cavity free in some time. It will take time, maybe 6 months, 7 months, or 1 year, but your microflora will change inside your mouth. All right. If it doesn't, if you do not go for a restoration, number one, you think that, you know, I did a restoration here, other one I'll do it later. Again, you are not curing the condition of your mouth. Somewhere there is a hub where these microbes are living. If you do not go for a restoration, later on, you know, this reaches the pulp. Pulp has nerve endings. Then it pains. Then you go for root canal treatment, crown and something, and then the infection goes to the bone. Sometimes you have swelling, you have, you know, these are different stages. So it's always best to hit it or to cut it off at the beginning. All right. Well, here are few things you need to remember about, especially the kids, about the cold drinks. Well, that's acidic in nature, and most of the time after food, after heavy food, people have the habit of taking, maybe it will be little helpful to you for digestion after a heavy diet or something like that. But remember, they're basically acidic in nature. And I told you, in cavities also, it is not the microbe or the microorganism which was eating your tooth. It was the acid produced as a byproduct of that microorganism eating onto the sugary diet that produced that hole. Same thing, if you have acidic drinks, obviously, it may not be a cavity kind of thing, may not happen because you are drinking water. You know, uniformly, it's going to erode your enamel. So slowly, you may develop sensitivity in long term. All right. Coming to the food. You know, if you take out a neonatal or an older than 100 years old skull, when we work in our anatomy department where we deal with the skulls, if it is a very old skull, you'll hardly find any carious teeth. But if it is a new skull, you have carious teeth. The reason being, you know, the food. That is, I told you the reason why cavities happen. It's the food pattern. I'm not saying, I'm not very strict on this, that you, I won't say do not take burger, do not take pizza. I can't say that. Well, if I say that, I'm little, I think my internet is little fluctuating. It's raining out here. Am I audible?
Yes, loud and clear.
It's raining out here. Okay. All right. So it's like, I won't say that. That'll be too much on a kid. But knowing the region of the etiology, at least having a burger after that, if you can brush your teeth, or you can just gargle it well with your finger or something like that, so that these food particles do not stick onto your dentition or teeth, it will be great. Well, then you can question, you have so many fruits which have sugary things, you know, the fruits on the top, they are self-cleansing. Remember, many people come to us for yellowish teeth, all right? I just advise them, you know, there are procedures like bleaching and all. Those are artificial procedures, but I advise them just go for an apple a day. Apple itself is self-cleansing. Within 6 months, your teeth is going to whiten up, including, I've seen that in some of the people who have deposits on their teeth also. Apple a day, biting it, that's important. So the front teeth, when you bite it, that's really self-cleansing, and the juice of it, I mean, whatever secretion comes out of it, that whitens the tooth. You can feel that effect in 6 months or so. So these are self-cleansing. All fruits biting onto it, they are very self-cleansing. But what we really, says the natural sugar which is there, it's not a favorite of Streptococcus mutans. In fruits or in your regular diets, it's not. Number one, they're not sticky. The first thing is all portions of your mouth, your tongue, your lips, cheeks, everything is moving. All right, that's not a good seat for them to sit and have a diet there. They need a quiet, calm place where they can have dinner with with their family. They can sit down, no one disturbs, and they can start eating things. So it's the teeth which are fixed. They are the best places for them to start eating their food. That's what happens. That is the main reason why we say you should brush before going to bed. Why that is important? It's because in the night you are sleeping. See, I'm speaking now. Even if I have some deposits on my teeth, because I'm speaking, all my muscles are moving. That's not the right kind of atmosphere for them to have their food. In the night, when you are sleeping, everything is calm, quiet, no muscle is moving and things like that. Is the best time they start having their dinner, or they have the whole day menu at that time. So even if you are very lazy and you think, no, 2 times I cannot do, ideally you should. If you're choosing for one-time cleaning, please do it before going to bed. That's the best thing to happen. Other thing I tell you, for kids, and as I said, I can't prevent you from taking chocolates or burger, pizza, or things like. If you are taking it, please clean your mouth after that. That's just 5-10 seconds for a healthy habit to crop in. And for parents, I'll tell, whatever things you have, let's say you have a chocolate gifted by someone, during the meal only you serve it. While having lunch or something like that, you can serve it before that, so that the kid goes and cleans the mouth after that. All right, and that's about caries. I'll quickly go, though this is a. Then I'll come to the gum diseases. What do you mean by that? Other majority of the dental agents are from the gum diseases. Tooth on the gum, what happens? See, again, I say it's about your brushing habit. In a place, if there is deposit, or you fail to clean that area for minimum 3 months. 3 months is 90 days, mind you. I have rice today. Some portion of the rice or food, whatever, is stuck into to one of my places in my mouth, between my teeth or something like that. All right. And next day I brush, I miss that area. Next day I brush, I miss that area. 90 days I miss that area. Then it becomes calcified. Slowly, it gets calcified. That's the rule of nature. I mean, if you look at sedimentation of rocks or things like, they slowly settle down and they attach hard. Now, that time you cannot clean it by a brush. This is what you see is calculus. We call it a calculus. But for developing a calculus of food or food remnant has to be there in place for 90 days. God has given you 90 days to clean it up. Even if you do not, everyone is brushing, right? Morning, if you do not brush, you don't feel fresh. This is what we have been doing it from childhood. We cannot change it. All right, we are brushing. It's not that 90 days we are not brushing. Someone asked me, why should I brush? Tiger doesn't. Bagh is there. Iske bagh is there. Hope he brushes. He brushes. I'm not talking about our batch tiger, but tiger doesn't brush. It doesn't have cavities. Why do I? Well, the simple reason is we have a fooding pattern which is quite different from what a tiger or a lion has. They don't need to brush because they have such raw food. They are itself self-cleansing. We are brushing every day. Then why is it that we miss out this area where the deposit is there for 90 days? The number one and the biggest reason for that is faulty brushing. There is a technique to brush. You have to understand the anatomy is not like a flat marble. You just clean it and it will get cleaned up. Look at the curvatures on the tooth, between the teeth. You know, this area, we call it an embouchure between the teeth, this area, all these areas needs to be cleaned. If you just put your brush straight this way, it's not going to touch this, you know, between the teeth and things like. That is the time when, you know, you have to know that what is important, how to do that. Well, I'll just show you some pictures. If I can incorporate this in my mind, in your mind, my session is a success. Only this, remember 90% of oral diseases or dental diseases are related with hygiene maintenance. Now, if you know a proper technique of brushing, if you know that you're brushing 2 times, hardly you'll be having dental problems. Because you saw that in caries, it's the cleaning that is important. In gum diseases, it's the cleaning. Always put your brush at 45-degree angle at the gum and the tooth junction. You need to massage the gums also. All right, put it this way. All right. Short oblique strokes, or to be more specific, you have to put it at 45 degrees and take it in the opposite direction. I mean, it has to be vertical, up and down rather than straight. If you do it straight between the teeth, there will be no cleaning. Even if you are doing 3 times brushing, it's not efficient that way. Right? It has to be, first of all, 45 degrees, then wiggle a bit so that the bristles get into the sulcus. Sulcus means the junction between the tooth and the gum. Once your bristles get down into that area, then you can always move it up or down. The regular is, if it is the lower or the lower teeth, you take it up, opposite to the gums. And if it is upper teeth, you take it down. Lower teeth up, upper teeth, it's down. It's not that difficult. Remember, in places where you have a narrow arch kind of thing, you may not put the brush straight, the front teeth, you can brush it in this way. Remember, next the query always happens is, which kind of toothbrush should I? For back teeth, outer or the inner region, it's up and down stroke to start with a 45-degree angle at the junction of the gums and the teeth. In the opposite direction. That's one. Second, for the top surface, remember this surface, you have to do it straight like this. Gentle. So remember, whatever food I had today, if I want to remove it today, it just requires a little bit of gentle brushing. It doesn't require hard brush to really work through. That's a wrong concept with people. They think if I use a hard brush, my cleaning will be better. No. Today, whatever I had, if I just take my finger and clean it, it will come out. It's not a very strong attachment on the tooth. But the same deposit, if it stays for 90 days, 1 month, 2 months, 3 months, stays there, it's going to be very hard. We call it a calculus, and you cannot remove it. You have to come to a dentist to do that. So let's be preventive in our thing and adapt a healthy kind of habit, what we can develop. Use a soft brush. Remember, your bristles have to be straight like this. Many times we see people working with, the bristles which are bent completely. Once the bristles are bent, then the efficiency of the brushing is going to reduce drastically. Studies have shown it's more than 50% or 60%. You may be happy that with the mint flavor of the paste, you must be happy that it's I brushed my teeth, but the efficiency of cleaning, how do we see that? There are fluorescent stains that is applied. They attach to the plate. Now you clean with 2 types of brushes, one with the straight bristles, other one with bent or distorted bristles. you'll find 50% reduction in your efficiency in removing the plaque. Plaque is that soft deposit that is there on the tooth surface and which you clean by the brush. Calculus is that hard thing which you cannot remove it by your own. You have to depend on your dentist for removing that. But anyways, you have to clean it to get started. Again, as I said, a typical kind of microflora is needed for causing dental cavities. The same way, once your mouth is unhygienic in the sense you have deposits, your cleaning efficiency is not good, you have calculus. The photograph you remember I had presented before. If you have such kind of condition or typical kind of actinomyces, we call it, that kind of microflora again stage in your mouth. Number one, it causes bad breath. Bad breath. If you're speaking to someone and if your mouth is smelling, it's not a good thing to really greet someone or have a good time. All right. So that's one thing very embarrassing with people. So you have to take care. And many times after cleaning also, after you think after cleaning or scaling, everything will be all right. It doesn't get all right. That's because of the microflora that is there inside. Again, it takes 6 months or 1 year or something to change the microflora population in your mouth. What you really do is sometimes we prescribe after scaling, after cleaning your teeth, we prescribe mouthwashes, Listerine mouthwash, and so many mouthwashes are there. We prescribe that so that constantly your mouth is killing these bacteria. So after a time they feel, no, this person is too harsh, let's leave his body or leave his mouth. And they stink and you regain back that confidence with a good smell. Yes, but if you have deposits and you just go for mouthwashes for a short time, just sprint and go have a meeting and come back, it doesn't help you because the disease is there inside your mouth. And this disease, gum disease, slowly grows up in time. Next is bad breath, bleeding, sometimes swelling in your gums, sometimes, then slowly your bone, which is supporting the tooth, that reduces, then that leads to tooth mobility. I hope all our friends, we are almost 45 plus, 46, we are having, at least we do not have mobile teeth in our mouth, right? So this consciousness is needed. It's all related with your cleanliness. If at all, the process is advanced by the time you're listening this lecture, take every precaution to regain back to a good orally healthy mouth. At least you can maintain your teeth in that portion. Well, we're talking about toothbrushes also. This is what you cause if you are really not brushing well. Hope you are finding my cursor. If you're using a hard brush and if you're thinking, I'll have to clean it nicely and you keep on doing it this way, this person is a left-handed person, right? He has been doing it like this, and these are what, again, they cut the enamel. Every day, if you keep on doing it like this, we have seen if there is a stone and every day you just rub your feet onto it, the stone becomes very polished, in fact, gets cut. It may be hard, no doubt, but every day, remember, every day we are brushing. Do not use a hard brush and never use a brush in a horizontal stroking pattern. Hope you understand what I mean here. Stroking is straight like this. Never use it. I told you 45 degrees, take it down. 45 degrees, take it down. Maximum time that you'll spend is 5 to 7 minutes a day. And that's worth it to have good food, chicken, mutton, everything you can have for future without a problem. All right. Let's be dental conscious and go ahead. You have electric brushes. Here they are actually less damaging. Why they're less damaging? They have a soft bristle, number one, and the movement is circular. The movement is circular. Basically, these are important for elderly people who have manual dexterity is less, anyone who is having a mentally retarded child, or someone who is, where the child doesn't have the manual dexterity to really clean it up well. Most of the times, kids, they just put it inside the mouth and they don't brush, they just put it, enjoy that 2 or 3 times they do it and remove it. This automatically rotates. This bristle automatically rotates, and the chance of damage like this, erosions and all, is less. Remember, if you didn't brush your teeth, as I advise now, take a go, start it tomorrow. If you want, I can give you the real-time videos also, how to brush. See, for any habit to make a break, you need 21 days scientifically, 21 days to take it a month. Once you do it continuously for a month, that becomes your subconscious habit. Then it really moves on like that. All right. This is another thing I would like you to sensitize to. Remember, 30% of your tooth area. If I take a tooth, 100% tooth area, 30% of the tooth area is between the teeth. It's between the teeth. Let's say it's a small gap here, but it amounts to 30% of the area. That's a considerable area. The cavity can begin between the teeth. The cavity or the calculus formation can begin between the teeth. So many of us actually, from the beginning or now even, we are not conscious how to clean the teeth between, how to keep the surface between the teeth clean. This is another thing I'd like to highlight on. Brushing the outer and the inner surface or the top surface, we cleaned it. How to clean between the teeth? You have a contact area here. Here are some aids. Please make it a habit. Interdental aids can be, they are the flosses, dental floss we call it. They're threads kind of thing. Do not use a regular thread. These threads are waxed and they are very fine. You just put it between the teeth and 2 or 3 times just clean it between it. This is going to help you prevent cavities to a very, very long extent. This hardly takes 1 minute to complete an arch, right? And these are disposable, hardly 20 paisa or 50 paisa per day. So your budget comes to be around 15 rupees or 30 rupees per month. But it really helps you. And you try it once, immediately you'll find your dentition very fresh. You don't need a mint to really achieve it. So try this. This is a dental flush. In case you have, this is the important thing. Flushing is not recommended in children with deciduous dentition or the milk teeth dentition. Regions are obvious. The manipulation, it may because they lack that manual dexterity to really stop at a point. They may take it further into the gums and all. It's not that encouraged, but then 10, 12 years, 13 years kids can start using it. Already, if you have a space, this is a flush. All right. Why this is important? Tongue cleaners are important. This is important because, again, I said you, bacteria, they leave. There's certain kind of bacteria also living on the tooth surface. You need to disturb them. You need to disturb them.
This animation will show how to floss your teeth. Click the navigation arrows below the animation to play or clean. It's very important. 45 centimeters, 18 inches.
You can find them on the
gently slide the floss between 2 of your teeth using a rocking motion. Be careful not to force the floss in or snap it into place. You may lose one of your teeth. Neck edges. Wipe your mouth. Continue using these steps until you've cleaned.
This is where you grip it through the finger. The other one I said, no, it's with a handle.
You can also
Unifloss is a brand. It's with a handle. You don't need to. Other aid is this one, interdental brush. They're like small bottle brushes. And in case you have space between your teeth, already you have space between your teeth, you can go for this interdental brushes.
This animation will show how to
I'll go for 5 golden rules. Maybe we'll end up this session here. It's like eat healthy food. Well, this is a very, very important thing. As we said, have more of fibrous foods, fruits, and all. You know, kids, what they do, they for the kids, the biggest teacher is your parents. They look at their father, they look at their mother, whatever they are practicing, they try to follow that. So you need to correct yourself to really teach your kid adapting to a good habit. Avoid sweet in between the meals. The only reason is if you are having it with the meal, you know, you can make a condition that way. At the lunchtime, you can serve that chocolate. You have to have some rules how to go ahead. Brush after every meal is a very overstatement. It's not possible for us. At least twice if you keep it. Morning hours, it's actually, you know, if possible, I'll tell it after the breakfast. If possible, take it after the breakfast. If you're doing it in the night before going to the bed. If you're doing it before going to the bed, your teeth are clean. Morning, you have your breakfast, then you clean it up. That's a better habit of developing. Other thing, important thing is fluoridated toothpaste and proper brush. What is fluoridated toothpaste? You know, fluoride content to a specific limit, of course, which are there in fluoridated toothbrushes, they form or they react onto the tooth enamel or the tooth structure and form fluoroapatites. This is something is quite resistant to the acid attack. The acids that are produced by the microbes, you know, this kind of surface, enamel surface, it's really, you know, it's resistance to caries. All right. So that's quite important. You visit the dentist every 6 months. Well, that's not possible out in here, but I'll advise you, you know, at least as a kid, when by 3 years, I don't know, we are going, I don't know, we do not have very young couples out here who have kids which are small, but by 3 years, most of the permanent teeth are, milk teeth are erupted. So that time you make a visit just to see that everything is fine. At 6 years, again, you have the permanent teeth which are starting to erupt. Any problems, any, you know, any malocclusion, irregularly arranged teeth or something is coming up, any bad habit is there, you know, that can be prevented. 6 years is another term. Maybe around 9 years or so is another. 10, 12 years is another. You know, 4 or 5 visits in a span of 12 years or so is going to streamline your dental condition of your kid. All right. That's, I think time will not permit to go to such a extent. What we'll do is we'll try to end up with this basics. Other things like malocclusion, crowding, we can take another session with the results. You know, something else, let me put it to you to be conscious about. Remember, any ulcer, we have so many gutka chewers. Okay, so be careful. Just never, you know, it happens because of the irritation. Any ulcer, small ulcer, which is lasting more than 10 to 15 days in your mouth, get it checked. Normally, oral ulcers should heal up. Normal traumatic or oral ulcers should heal up within 7 days, or 10 days. If it is lasting for a longer time, however, you know, they're looking bad. I've seen cases where they're just like a cut in your mouth, but that leads to a malignancy. All right. The earlier we pick these cases, some other day, maybe the oral cancer, we can take it up. Let's wind up. These are few things. Maybe you should look for gingiva, mucosa, how to check which surface, these are different places available on the internet also. Other part is the pregnancy. Remember, during pregnancy, the hormonal changes happen. Hormonal changes happen. So you have small lesions like this. When there is a hormonal change, let's say X number of bacteria, which were quite normal for me as a healthy human being, it will cause reactions or response to the soft tissues in pregnant women. So pregnant women need to be really, really careful about their oral hygiene. We call this as pregnancy tumors. They bleed like hell. I've seen people in third trimester in pregnancy and bleeding like mouthful of blood. It's nothing to panic, but it's because of bad oral hygiene and irritations like calculus. I said, stone deposits. So make it a point to your relatives or anyone, or if is pregnant, once diagnosed with the pregnancy, please go for a oral prophylaxis, that is scaling, polishing, cleaning. At least for coming 9 months, you'll be safe and won't have complications in between. Remember the psychology of a pregnant woman who's bleeding profusely in his mouth. All right. Remember that's very important. Same thing happens with kids with during their puberty. This is all calculus, stone deposits. All right. After cleaning up, they look better. And all right. All right. I'll just quickly go through. Again, next concern is the elderly people. Number one, the manual dexterity. Probably, if your parents, this is important for us because our parents are really aging now, and how can we take care? A power toothbrush, I'll advise you, it's not expensive, available everywhere. That manual dexterity is using. Let's not, allow them to suffer from any kind of pain or dental related issues. Let them have a better life to move on. All right. That is the main thing. It's related to the, if you look at the general health, let me tell you, chewing, swallowing, nutrition related. All of you agree to it. TM joints. These joints are TM joints. All right. Once you lose function by losing your teeth or so, like knee joints, those who have problems, osteoarthritis or rheumatoid arthritis, they know the problem associated with it. Maybe none of us have experienced it till now, but you ask the elderly people who have these problems. These problems are very, very nagging problems. When you have, so you have to be careful about your TM joint, this joint. At an elderly age, if you have teeth or the dentition, see, it's related with your dentition, which is missing, you haven't replaced the tooth, your chewing pattern is wrong. Once you have some missing teeth and some teeth are occluding badly, that can be transmitted to your TMJ, and we call it a TMD, temporomandibular joint disorders. Those are nagging problems, absolutely, like on medications throughout, no treatment all through. All right. Increased susceptibility to systemic infections, dexterity, mobility issues, all these are related with dental problems. Okay, we had a discussion. Prevention strategy, education is one, probably at least 5-6 points. Those who are attending today, if you have taken it and try to apply it in your day-to-day life, it's really going to be a great time dentally in future. Artificial teeth, these are important. Again, the habits, few children have their habits which we prevent at the right time. These are a few programs that we carry out. Fluoride programs, I told you, fluoridated brushes. We work on these issues at the slums or whatever. So many NGOs, they invite us for these programs, and it's worth knowing the enthusiasm of the kids in the slums or underprivileged ones. Remember, India is changing. We are having a new face altogether. Everyone is boosted with confidence, including a slum dweller, whoever is working. They try, look at the impression of the kids, how to brush. The face, these are real-time photographs, and that is the way we are looking forward. There are myths, taboos also, reluctant to undergo dental treatment because they're afraid they'll lose their eyesight. You know, extraction and eyesight, people relate it. Remember, dental department and eye department, these are diseases of civilization. Why I call it diseases of civilization? You know, you had, now everyone is dealing with computers, laptops, things like you hardly find a kid without a specs. All right? These are diseases of civilization. More we adapt to the high-tech things, more we lose the eye pattern. Same thing with dental. The food habit, the way it is changing, and the dental diseases are coming up. So you cannot link, you think because of the cavity, I extracted a tooth. After a month, I had to use a specs. I thought my tooth and eye, they are so close, and that's why my eyesight was lost. It's a taboo, remember. All parts of our body are connected. A nerve going to the eye and nerve going to the tooth, they are separate, and they come through the same foramina magnum. Right? These are just coincidences, nothing to do with that. Some patients come up with the dentist chief complaint of tooth decay, demand that the dentist should sew worm in their teeth. These are gone that way. But remember, this is an important thing I'll tell you. Some people think if you go for scaling is cleaning of your tooth by vibration. You lose enamel, you weaken your tooth. No, the scaler, the instrument is as such, it's a stainless steel blunt instrument. It has a sonic vibration with which it removes the tartar or things like that. Okay? It cannot cut a tooth. A tooth or an enamel can be cut by diamond, it's that hard, or tungsten carbide. It cannot be cut by stainless steel. The hardness of stainless steel is not that much that they can cut a tooth. So it's always better to go for, you know, the book advises every 6 months you should clean your teeth professionally. At least once a year in India, Indian standards also is fine. But I find people 20 years, 30 years, they have never visited for cleaning their teeth. You understood your, you know, your shortcomings in the sense you cannot reach every part of your tooth between the teeth and so many things. So you will have deposits. Maybe a yearly or 2 yearly scaling is good for your teeth. Neonatal teeth. Well, that ends my presentation. This happens to be my clinic, which our clinic, which is, you know, it's a passionately made of these. Of course, these are old photographs, and many of our friends have visited me. It's out of sheer passion that we have built up this. Any questions we can take up now? Any doubts, or I just go to the chat and let me see.
I think Sam can coordinate, and maybe people can ask questions.
Yeah, yeah, Surya. So
Devi sir was having a question.
Yeah, I'll just coordinate the question. So just let's go by in order of preference. Okay, so whoever has put in the questions first, we'll take up those. Okay, I think first in from Ranjan, I think, I grind my teeth in sleep. What option do I have?
You grind your teeth in sleep. That's bruxism, which is really alarming. Alarming in the sense which is really damaging to your tooth. That's an extra function you're doing. So remember, from 6 years onwards, we are using our teeth till we die. All right, that's lots of work we are doing. Grinding, chewing, so many things. Again, putting an extra effort by grinding during night time is not welcome. But it's multifactorial. You cannot address it with one go. This happens. It can be because of stress. It can be, you know, so many times people say that you know, because of worms you have it. Substantially not proved, scientifically not proved that way. But one thing I can tell you, one solution can help you from damaging your teeth. I may not be able to stop your night grinding habit. So many multifactorial, one single cause cannot be pointed out, but we have mouth guards. What is called as a mouth guard. These are soft kind of coating which is given, soft kind of coating or a clip-on onto the tooth which is given before going to bed. You just put it on, and it's a complex. Actually, the grinding is a complex neuropsychological balance. Balance in the sense, once you move one way, you feel like doing it again. That's a very difficult thing to decode. But if you have this kind of mouth guards which are smooth on the surface, now your teeth cannot grip like this. They'll be smooth like this. Okay, something like they'll be smooth, so they cannot grind onto each other. So that's a solution I can tell you.
Okay, thank you, Surya. So we are just running out of time, guys. So we'll just little hasten up a bit on the questions. So the next question was from UT Rao. Would you recommend electric toothbrush especially for children?
Yes, I will recommend, because most of the time children, they lack that, the things I told you. Can a child really pick it up? Let's be very practical in our approach. I told you, put it in 45-degree angle, keep it there, wiggle a bit, see that your bristles get into the sulcus. Sulcus between means the tooth and the gum junction, and then move it this way. I don't think any kid is going to, kids more than 12 years, 14 years can pick it up. The kids less than that, it's difficult, or this is over expectation from them to do it. So kids, any person with lacking manual dexterity, all the regions I said, special child, elderly people, whoever, or if even you think you are unable to maintain this, you use power toothbrushes. They are scientifically proven more efficient in this kind of cases. Over to you, Sam.
Okay. Thank you again. So I think there are kind of a series of questions from Ishan. We'll just try to quickly take each of them. I think most of them are like statements, and I think he may need a confirmation from your side. So the first one is, I've stopped brushing in the morning for last 10 years, has found brushing before bed to be appropriate. I use a flexible toothpick to clear my food from corners of tooth. The flush thread was found to be ineffective for me. So any comments on that, Surya?
Well, I agree with you. Even if you want to brush once a day, do it before going to bed. That's a good thing. If you do it twice, do it after the breakfast, because breakfast is usually heavy. And for working people, you do it after the breakfast. No need to really do it in the morning before the breakfast. Number one. Then flexible pick to clear the food is fine. If flushing, see, there are categories of interdental things. Flush is the smallest. People who are really healthy with very tight contacts, you cannot insert a flexible pick inside. The flush really works fantastic there. People who have already, some gingival recession is there and some kind of spacing is already placed in. There, the Proxa brush, flexible toothpicks, they're going to work. It's perfectly fine, whatever suits you, but between the teeth, it is to be clean.
Okay. Okay, Surya. Ishan, in interest of catering to questions from all parties, so you have many questions. We'll come back to it. Let's pick up one question from Devi sir. Devi sir, if you can go ahead with your question, please.
Dear 92 batch, I'm privileged and I'm floored with the kind of initiative. And I wish all of you had your videos on. I wanted to take a screenshot and put it across to all the media lot that what you people are doing, because I'm deeply into the media, you know that. And I would do it today. So Sam, if you can coordinate nothing like it. Now I have a question for the great doctor. I have and I've been on a haunts of the dilemma since years. Now I have multiple, toothpaste here, starting with the allopathic ones, the homeopathic, Ayurvedic ones, Himalaya, then Meswalk, then over here Colgate, and then your Colgate, and of course the one page from Reddy's lab. Kindly could you tell me which one at my age of 68, I have some non-infectious ulcerations in my upper and lower palate. And my dentist is your able junior, Dr. Niladri Behra, who is in Bhubaneswar. Now, can you tell me which would be the ideal toothpaste for me? One.
Okay, sir, I'll come to this. First of all, it's my privilege to answer you, sir, here. I stick to one point. What is toothbrushing? Toothbrushing is a mechanical cleaning. Right? You have to understand what is toothbrushing. It is a mechanical cleaning. X, Y, Z, 1,000 companies are there. All right? And you're brushing it for 5 minutes only. If your brushing technique is fine, and every toothpaste is foam kind of thing which reduces the surface tension on the tooth, every toothpaste, right? If your brushing technique is fine, 90% of the chain problems are done. Brushing technique, you have to reach every corner to wipe it off. That's it. X, Y, Z, any brush or the paste, it hardly matters, sir. It really, I mean, it doesn't. Especially, of course, if you have cases which are caries prone, you go for fluoridated toothpaste. I'll advise you that way. If you have something like, let's say, you have a specific disease, then I'll advise you, go for this paste which has a content which may help you some way. You're just doing it for 5 minutes and spitting it out. Right? It's not the paste that is important. Majority onus is on the technique of brushing. So you stick to the proper technique. There's so many videos available. I will also share it in a practical what we shared the patient in our clinic. I'll share that video. Try to stick to. Do not get confused with charcoal, with this thing. That these are all salt. These are all simple, sir. The logic is this: every paste has a surface tension reducing agent in it, like a soap. Soap reduces that surface.
Okay, thank you. I will quickly follow with another because we are running short of time. I have many toothbrushes here. This is another dilemma. I have one kind of a toothbrush which I'm using. You can have a look. Then one of my favorite is that Vijaya, which has a broader face, squarish, rectangular. Then there is this one, corrugative kind of a thing. Which possible brush could be the idea?
Sir, again, I'll go to the basics. What do you want in a brush? You want your brush to reach every place. If you're choosing a large brush, probably the back of your teeth, you're not going to reach. You cannot reach that place. It's a big head. It's a big head. You cannot reach to the last tooth of your this thing. Try to choose a soft brush, number one, a smaller head. Smaller head is good. You can reach to every extent. And a brush where on the back side, there'll be unitough. Unitough in the sense, only a small bunch of bristles will be there. Unitough, we call it. Many brushes have it in the back. The head is this big, or you have, how can I say that? If the head is this big, at the back, you'll have something like one bunch of bristles only. So the places where you fail to reach, at least you can reverse it and clean that area. We call it a unitough brush. You choose it accordingly, sir. Small head helps. Zigzag, I don't think there is a big difference in the efficiency. You are in the proper way.
Thank you, Sam.
Okay, so friends, the session might to disconnect now. Do we want to continue? We'll have to relog in again.